Hello, my name is Marco Koreniak and I'm the president of European Liver Patient Association.
I'm Professor Jessica ZUCMAN Rossi. I am a medical oncologist and the head of the laboratory working within Genial.
Thank you very much, Professor, for being here. So can you explain more what exactly do you do in your work?
So in our work, we are specialists in the identification of new genetic factors that predispose to hepatocellular carcinoma, but also to other type of liver cancer or liver tumors. And we are also very interested in understanding what is the relation between the exposure to different environmental toxic or habit and the fact that we can, with our genetic background, be more at risk or protected to the development of liver tumors.
So this is the work also that you will do with the Genial program?
Absolutely. So we are in charge of coordinating the first work package of Genial program that aim to identify some new genetic factors, common variants that are very frequent in the general population and that can influence the risk of development of liver tumor, or more rare variants that can also have this modulation of the risk of hepatocellular carcinoma, specifically in the population of patients that have a high alcohol intake. And we want to focus on this particularity in the Genial project because we believe that alcohol is studied and we want to have more information on this population.
So how do you do your research? You take blood or you take samples, or how do you do?
So we take samples from the patients. It can be blood, it can be also part of the liver tissue or the liver tumors also. And we analyze these samples, we extract the DNA and we analyze to identify some mutations or variants.
So I guess your work is extremely important for physicians to know what is going on, but also it's beneficial for patients to know if they will develop something or not.
Yes, the idea is really to identify also the patients that are the most at risk of development of hepatocellular carcinoma, so we can follow them more carefully and more frequently, for example. And it's also a motivation for these patients if they have a genetic background that is at risk of development of liver tumors, to decrease also the alcohol consumption, and because if there is an interaction between the genetic background and the alcohol consumption, it's really time to really reduce the consumption of alcohol.
Dear Professor, thank you very much for your time and your work.
Thank you. So.